Okay. Hello, good morning, everybody. Welcome back to ASMIHA Corner. I'm your host today, Dr. Makhyan Jibril Farabi, and today we will discuss about topics which is very interesting, cardiac registries among ASEAN. Joining us today, the elected president of AFCC, the cardiologist and also researcher, Dr. Alan Fong. Thank you very much for coming today, doctor.
Yeah, good morning, Makhyan.
Thank you.
Pleasure to be involved.
Yes. We are very interested about the registry of cardiology in the ASEAN region because we already read your paper in APSC journal. What is the challenge that you think will be happen in the ASEAN registry for the cardiovascular?
I think the formation of a registry in every country is important. It's an opportunity to collect our own data and understand whether and how we are performing in terms of disease management and procedure management. Like in Malaysia, we established 2 registries, one from acute coronary syndrome and one for procedure, PCI. Subsequently, we had a nested registry for heart failure for 1 year. Thank you.
And then, I mean, like to make a cross-border registry, the challenge will be some countries have different registries than the others. How did you harmonize all of that registry?
Yeah, this is always a challenge because we all have different healthcare systems. But collecting a registry, cross-border registry, will require a different kind of effort. It is definitely possible, but whether it is feasible or not will require a lot more discussion and conversation. We have had a few successful collaborations in terms of cross-border registry based on specific topics alone. For example, like the STEMI. Yeah.
And how about in your center? Have you established your cardiovascular registry very well in Sarawak?
Yeah, so our center is one of the contributing centers to our National Cardiovascular Disease Registry for both acute coronary syndrome and percutaneous coronary intervention PCI. And we have done so since the formation of the registry in 2006. So nearly 19 years of experience and data collection. I think the biggest challenge is sustaining the registry. That means giving it going with good data quality. In Malaysia, our registries are voluntary registry. That means the centers contributing are not compulsory. However, the opportunity to do so in a more unified and organized manner will provide a lot of data and a lot of opportunities.
And I think one of the challenges of the ASEAN is some of the countries have high income, some of them are less. So the quality of the data usually will be different from the country which have a higher income compared to the lower income. So how will be your strategy to tackle that?
Yeah, that's a very good question. I think sustaining the registry requires a lot of effort.
Exactly.
So whether the income status of the country is probably a secondary importance to the commitment of the site.
Exactly.
So if it's a small registry, you need a small number of staff to collect the data. But for a larger registry over time, and you can quite imagine the data management becomes quite of a challenge. Yeah.
And what do you think if we are successfully build the ASEAN Cardiovascular Registry? What will be the next after we complete this? Maybe integrated with AI or something, digital health or something like that?
Yeah, I think pragmatically, going forward, we have to decide whether we want to set up a disease-related registry or a procedure-related registry. So if you wanted to do a cross-border TAVI registry, for example, then perhaps certain sites to be involved rather than a national effort. So I think if site to site at every country to form a nested registry over a certain period of time. So for example, if you're collecting data for 1, 2 or 3 years and follow up for 1, 2 or 3 years, it becomes well defined. And I think with that, the data quality would be maintained. To run a registry for 19 years is always a challenge.
Yeah, of course. Yeah. And then maybe your last sentence for everyone in the future, how do you suggest the young researcher or any cardiovascular society to build a registry and make sure that we work together for the ASEAN Cardiovascular Registry? Please.
I think the most important aspect of having a registry is the data collection. The data collection allows us to learn more about ourselves and of our patients. Data from registries provide a real-world evidence platform, which is a bit different from if you're doing clinical trials. In doing clinical trials, you have a controlled environment, but to see how the the drug, the procedure, the guidelines are all translated to real world, our own clinical setting, then a registry at a local level becomes very important. As we collect our data, then we can apply different techniques, for example, AI-based techniques, to enable us to refine how we are going to manage each patient better. Ultimately, when we become sick, for example, with acute coronary syndrome, we are going to be admitted in the hospital. So I would be rather to be admit myself to the hospital that has a structured data collection.
Exactly.
Yeah, rather than one that is without. So because if I know a hospital is doing structured data collection, for example, like in a registry, we know the hospital or the institution is more serious about data quality and therefore quality of care for the patients that attend there.
Yeah, thank you very much. So with this half a billion of the population, the ASEAN, this will be a very big potential for developing the ASEAN cardiovascular registry, and hopefully we will work together to achieve that. Thank you very much, Dr. Alan Fong, for today's session.
Yeah, thank you very much, Makhyan.
Yeah.
Have a good day and a
Have a
great
good day.
meeting in the ASMIHA. Yeah.
Bye bye, everyone.